So, Daratumumab is the first monoclonal antibody medicine that has been approved for the targeted treatment of multiple myeloma. So, it is a first in class kind of medicine, and it's been proven very effective and safe in patients, either as single monotherapy or in combination with up to about 4 or so different medicines that are all currently standard of care myeloma drugs. Now, combinatorial use of this drug in different treatment regimens helps, especially when it comes to the management of relapsed or refractory disease. The drug is a fully human antibody of the IgG1 subtype with a copper light chain, and the target here is the CD38 molecule, which is heavily expressed on the surface of malignant myeloma cells. And by targeting this molecule, it acts as an anti-myeloma drug, mostly by immunological mechanisms, which aim to eliminate these malignant cells. Note that multiple myeloma, which is the second most common blood malignancy after leukemia, is still quite an incurable disease. The myeloma cells are the plasma cells which, in normal circumstances, produce antibodies which help to fight off infection as part of the humoral immune defense. In multiple myeloma, these cells become malignant and produce abnormal antibodies, also called myeloma proteins, which deposit in tissues all over the body, resulting in clinical findings like anemia, unremitting bone pain, multiple infections, and renal disease. The benefits of daratumumab is that it not only induces lysis of these cells via mechanisms that we talked about, like ADCC, antibody-dependent lysotoxicity, ADCP, antibody-dependent phagocytosis, and TDC, which depends on complement. It also strengthens the anti-tumor activity of the immune system, so effectively boosting T cell responses and induction and inducing cancer cell apoptosis. For multiple myeloma, the drug was first approved by the US Food and Drugs Administration, and then in 2015, and then the following year by the European Medicines Agency. That's in 2016. Most regions of the globe have now approved its use as well, but of course, as with any antibody medicine, the cost can be quite high, going over 4,000 British pounds per infusion. And so you can kind of see how this can accumulate if you're using the treatment for a year or more. Okay. The drug has also been approved in 2021 for the treatment of systemic light chain amyloid disease, especially in newly diagnosed cases. The disease is characterized by abnormal deposits of monoclonal antibody light chains, quite like multiple myeloma, in various tissues of the body, and that this then leads to the rapid decline in the normal function of the affected organ. So then you're looking like things like clinical findings such as renal and cardiac dysfunctions, anemia, bone symptoms, and swelling in various parts of the body. When you're casing the wrist, you have this carpal tunnel syndrome, and in the tongue, you have enlarged tongue, what we call macroglossia. Again, the source of these amyloidogenic light chains, which is what they are called, are the plasma cells, the malignant plasma cells. And so targeting the CD38 molecule will again allow immune-mediated depletion of these cells and an overall reduction in the burden of the disease, which then will allow for the improvement of overall survival in patients. So now, these two diseases may be controlled by daratumumab, used as a single agent only, especially in situations where pre-existing standard of care medicines have not been able to effectively clear the disease. Now, it will usually be started as a weekly infusion for the first 8 weeks or so, then fortnightly up to about the 6th month of treatment, and then monthly thereafter. This regimen may be changed should the drug be used as part of a combination plan with other standard of care medicines. Some of these medicines will include things like the proteasome inhibitors, the likes of bortezomib, galvizomib, and ixazomib, which is given orally, The first two are parenteral drugs given IV or subcutaneous. And all of these sort of targets the proteasome within myeloma cells, eventually killing the cells quite selectively. Then we have the immunomodulatory drugs like lenalidomide, pomalidomide, or even thalidomide. And these sort of boosts the body's immune response against the myeloma cells, and some of these are given as oral capsules. Melphalan and cyclophosphamide are DNA alkylating drugs, and so inhibits the continuous replication of the malignant myeloma cells. Dexamethasone as an immunosuppressive, as a broad spectrum immunosuppressive, is also used, and it may also help with the persistent bone pain in patients, because then it will also target some of the pain pathways that are involved in pain perception with the disease. Now, hyaluronidase is added to this regimen to attempt to sort of increase the response of the drug, the response of the myeloma cells to the other drugs within the regimen. And so essentially it's an enzyme that degrades the extracellular matrix to allow better penetration of these other drugs. But then in of itself, it may also help to reduce the overall growth of these tumor cells. We have Darzalex Faspro, which essentially is Daratumumab that has been co-formulated with recombinant human hyaluronidase. So effectively, dexamethasone and hyaluronidase could be considered potentiators of the classic anti-myeloma drugs, and using these drugs in combination sort of confers synergistic effects, which ultimately leads to an excellent response and prolonged progression-free survival in patients. There are some adverse drug reactions to daratumumab, but these are often managed quite effectively. For instance, by pre-administering antihistamines to prevent infusion-related reactions, or using subcutaneous formulations as alternatives to intravenous infusions. Also, because the CD38 molecule is expressed on normal hematopoietic cells, not just the malignant plasma cells, it is quite important to know that the drug may affect the levels of these cells, these normal cells, leading to a low white cell count as part of a pancytopenia, and this can lead to various infections or risk for infections. But the use of prophylactic antibiotics may be prescribed to help to prevent some of these infections, together with a cautious monitoring for symptoms and signs of these infections.